This bloodborne pathogens presentation contains important information to help ensure the safety and health of yourself and your students. Bloodborne pathogens are referred to as BBPs. They are found in blood and other bodily fluids with visible blood, for example, vomit with blood. Only a blood test can confirm infection. The three types of BBPs are human immunodeficiency virus, commonly referred to as HIV, hepatitis B, or HBV, and hepatitis C, HCV. HIV attacks the immune system. HBV and HCV attack the liver. A person can go years without symptoms. Dried HBV can survive on surfaces for up to 1 week. This is one reason it is very important for you to call the office and ask them to send a custodian with the proper cleaning chemicals to come and clean up after an accident such as a bloody nose or a child throwing up. All bloodborne pathogens are transmitted in the same ways. They are spread through contact with infected blood, contact with bodily fluid containing visible blood, and finally, sexual transmission. The doorways for bloodborne pathogens to enter your system are cuts, nicks, scratches, skin abrasions, dermatitis or acne, as well as through your eyes, nose, or mouth. If you have to apply first aid to a bleeding wound, you should wear gloves. There should be a set of disposable plastic gloves in the teacher's desk. You should check your exposure control plan. You are to consider everyone a carrier. You should cover your cuts and nicks before you put on gloves. Be sure to remove gloves properly by peeling them from the back and turning them inside out as you go. Other ways to protect yourself include using a mechanical respirator or pocket mask if available, replacing protective equipment if penetrated by blood, disposing of all materials properly, never holding trash bags from the bottom as they could be leaking, and using a broom and dustpan to pick up sharp items. If you think you have been exposed, don't panic. Report the exposure to the school nurse. All of our nurses are registered nurses. They will help you set up post-exposure treatments if necessary. Arrangements can be made for testing, counseling, and any follow-up necessary. Some final quick tips to avoid exposure. Keep hands away from your face and wash your hands often. Finally, if possible, have the injured party stop bleeding or apply direct pressure themselves whenever possible.